Hi there, so welcome to my YouTube channel and I'm doing CRI in Balaji Hospital. So I always wanted to make a YouTube video regarding the final year and study plan. So when you enter the final year, you're always confused. Okay, where to start with and what to do and all those stuff because you are bombarded with many clinical cases and many theoretical questions and seniors advices, isn't it? So you are kind of a jam in between both the breaths. You have no idea what to do and whom to listen and what to do actually. So here I am with the first tip. You should sleep a lot. I'm kidding, you shouldn't. So first thing, you should always promise yourself that behind your mind there is always one word: revision, revision, revision. Um, in final year, your 70% of your time should be in the revision. You should have, until and unless you realize that you are wasting your time for revision, that is when you are still in the race. If you think you are still studying some topics, that means you still have to cope up and come to that come to that zone where you should feel that you are still revising. Get it? Here I have my phone over here, so I have wrote some points where I won't forget it when I'm discussing here. Okay, so coming to the topics first, I will first take surgery as a subject. Here, don't first dive into Bailey or SRV. You the textbook's names sounds really good. I do agree, but go to your first year subjects, first year anatomy subjects such as BD Chaurasia and Vishram Singh. Try to revise everything or topics what you are actually going to study in surgery. Say hernia. Try to go back and study the anatomy of abdomen. You should study because I am very sure you would have forgotten by now everything, even the layers of abdomen too. Yes? Yeah. Yeah, after getting the theoretical idea, go to your clinical wards and see the patients, see the hernia patients. If you are restricted to go to the ward, then go to the YouTube channel and then see the videos over there. I'm very sure you won't forget those videos which you are seeing after you know the concept, what it is actually, what it actually is. Okay, and after that you should always, once you finish a clinical topic, try to cover up all the university questions what is there with it. If you say hernia, try to study all the hernias associated with it, not just the what to say inguinal hernia. Study all the hernias what is asked in the university question. Okay, don't keep it for last. If you are studying the theoretical questions, that means you are still in the race, you are still revising. Okay, clinical scenarios, clinical discussion you will already be doing in the classrooms, but that is the other thing, if your presence of mind is still there or not. But I would suggest in the clinical case, in the clinical classes, try to first read what your friends would actually present the cases. Then once they say no history of so and so, no history of hematemesis, no history of anything, so you can actually correlate. Okay, fine, so you can rule out so and so things, you can rule out this thing, you can rule out hypertension, all this stuff. Okay, so yes, so we have finished with the surgery. Now coming to the medicine. So again, don't just dive into the Davidson. Okay, first, if you take CVS as a system, go and study the physiology, go and study the circulation, go and study the pharmacological aspects of that particular subtopic. Okay, then only you will understand medicine. I know it would be lame, but it is a genuine one. Imagine medicine as a girlfriend, and physio and pharm is the one who would actually impress your girlfriend. Okay, at times biochemistry, but the thing is biochemistry plays a minor role. Say for blood and all, you need to know biochemistry, so that you can actually cover in the medicine itself, but you should have an idea about what it is. Okay, but if you have a to be honest, final year is just the knowledge of your previous years, what you have studied, what you have read, what you have gained knowledge in the previous years is your final year. Okay, if I know in the starting few years you will be in a dilemma. Okay, why did we join MBBS? And then you would be having a jolly time. The honeymoon period of the MBBS, you would be having a nice time. But in the final year, you wanna regret it. But yeah, I'm making this video for the final years, and I know you guys regret it by now. Okay, so we finished medicine. Talking about the pediatrics, I loved neonatology. See, we always tend to study the developmental milestones, and we always tend to forget it. What I did was, if you have some kids in your home, try to see them, try to see what they are doing. Are they crawling? Are they standing up? Are they walking? Are they climbing stairs? Are they talking? Whatever are they doing, try to correlate with the knowledge you have acquired in the Paeditrics book. Okay, so yeah. Also, when you talk about the pathological aspects of pediatrics, say jaundice, physiological jaundice and pathological jaundice, try to compare these two and study together, because I myself have done a blunder in the model exams where ma'am asked me what is pathological jaundice, but I instead said about the physiological jaundice. And after then I started comparing these two things and studied them together. You should actually compare and study whatever it is, medicine, surgery or pediatrics. Compare and study. Okay. And yes, always one more thing, if you know medicine, if you are pakka with medicine, you can actually know pediatrics. But there are some topics in pediatrics which are actually volatile. You should actually remember some formulas. Say for the malnutrition, for the SAMs, you should actually learn some formulas. Apart from that, it's cool. It's actually a cool subject. And also, you can't risk the child's life at risk, right? So that's why it's a bit volatile. And favorite, obstetrics and gynecology. So what do I say about this? So see, I would say, if you guys have marrow, just go with Sakshi Singh Arora. You don't need to go to the first year subjects and study everything about the female reproductive system or male reproductive system. Nothing. You just go to Sakshi Singh Arora's lecture and you will come to know everything. After going to these lectures, her lectures, and you should actually listen to the clinical cases, what they are discussing in the classes. That will actually build your concepts. Okay, if you just go there and listen without any knowledge, any background knowledge, you will actually tend to forget it and be very boring. So try to have a basic idea before you go to any clinical cases. So that will actually keep you interest. I'm so sorry for the sound. So that will actually keep you interesting and motivated. Yeah. So yeah, this goes for obstetrics and gynecology both. Okay. And again, once you do the clinical aspects, try to cover up all the university type questions of that particular subtopic or topic, so that you still know you are still in the race. Okay, so I have covered with these surgery, medicine, pediatrics and OBG. So yeah, that's all I guess. If I have anything more updates, I will surely let you know in the next video. Thank you. Bye. Take care.